So today I'll be talking about diabetic retinopathy and why it is so important to maintain the normal blood sugar levels so as to avoid complications which get to the retina. So the retina is the most sensitive part of the eye, and it consists of blood vessels as well as the nerve cells. Now the nerve damage has to be avoided because the nerve cells do not regenerate, and that's the reason we have to pay close attention to the symptoms. Now, what are the symptoms of diabetic retinopathy? There could be blurring of the vision. There could be also, night blindness as well as floaters, which are very much visible in the sense the patient is not able to have a clear vision. There could be black spots. Also, there could be areas where there's no vision whatsoever. Initially, the peripheral part of the retina is affected. That is the reason why the symptoms don't appear that quick, because the central vision is restored. But as the pathology progresses, definitely the symptoms begin to come, and that's the time that the patient approaches the doctor to understand what's the problem with the eye. Now, what we discussed earlier is basically to do with the non-proliferative type of affection of the blood vessels, where the blood vessels swell up and there is minimal leakage. But as the pathology progresses, definitely the blood vessels, they regenerate, and there are additional small tiny blood vessels which they form, and they bleed into the vitreous fluid. Now that's what we call as a vitreous hemorrhage. Apart from that, the additional blood vessels, they also undergo a process of healing, causing scarring over the retina, and this can pull the retina and cause its detachment. That is the retinal detachment. Now both of these, be it retinal detachment or vitreous hemorrhage, is a medical emergency, and definitely it requires a surgical intervention. Now, to avoid such severe complications or a critical situation, it's very important that you maintain your blood sugar levels. That is your HbA1c, that is the 3 monthly, the average blood sugar that levels that we see. You have to maintain it below 7, and the mean is 5.7. So these are the normal HbA1c levels. If you maintain these levels, definitely all these complications can be avoided. Apart from that, your blood pressure has to be maintained, has to be checked regularly, and also your lipid profile, that is the triglycerides and cholesterol, has to be regularly monitored. So it's very important that you are aware about the symptoms. The prognosis of long-term diabetes 1 or type 2 can lead to such severe complications. But a good lifestyle habits, a regular exercise routine to neutralize the high levels of blood sugar, and medications, timely medications can definitely be helpful in maintaining the normal blood sugar levels so as to avoid such complications. So this is all about diabetic retinopathy.